Hello, Carlos. I am your nurse, Sam, and I'm going to be sharing with you about your new medication, Warfarin. And the first thing with it is that it is used to treat or prevent blood clots, and it's also to lower the risk of heart attack or stroke. And since you have been experiencing some new symptoms with your heart and your chest, then we wanted to start this new medication to see if it will help, and if there's any changes to those symptoms, if they get worse or don't get better, then we will check in with you about that. Some of the most important things to know about this new medication is that you would need to call the doctor right away if you had any symptoms of bleeding problems. This would look like bruising, black tarry or bloody stools, bleeding gums or blood in your urine. Also, if there's any cuts that take a long time to heal and they don't stop bleeding. If you're feeling dizzy, tired, or weak. If you're experiencing nosebleeds, pain, or swelling, or if there's a very bad headache. The next big part that is important with this new medication is that you'll have to be getting blood work done on a regular basis, and this is called a PT-INR. So while this test is important because it will let us know if the medication is working correctly, if it's doing what we hope it will do to your blood circulation, if it's doing it enough or doing it too much, then we'll change the dose. But this test will help us kind of keep track of that for you. And there's some things that we want you to just be aware of with this is that you want to tell any of your doctors, nurses, pharmacists, or dentists that you're taking this medication, especially if you're going to get any new surgeries or even work done on your teeth. And if that is the case, then you would stop taking the medication before those things. But it would just be good to communicate about that. And then you also want to do everything you can to prevent injury or avoid falls or crashes. And if you did fall or hurt yourself, it would be really important to get checked out by your doctor, even if you're feeling okay, because this medication can increase your bleeding. And so we want you to just check in if anything like that happens, because you may bleed more easily, and we would even suggest using a softer toothbrush and things like that, so it doesn't increase the chance of you getting hurt. And then it would be important for you to also be aware of the vitamin K in your diet. And so this vitamin in particular changes the way that the medication works. And it doesn't mean you have to take out all of the foods that have vitamin K, but it would be important for just the amount to stay the same from day to day. Just as an example of some of the things that have vitamin K, it's green leafy vegetables, broccoli, liver, and some kind of vegetable oils. We can give you a list of those if you have any more questions or are concerned about any of those. It's also related to the vitamin K. If you are taking any multivitamins or diet aids, those could have vitamin K in them, and so let us know if any of those are being taken. And we also are going to help you with a patient safety card, and that's just so that you can carry it with you at all times, and that way if anything were to happen, whoever would be treating you would know that you're on this particular medication and then would take the precautions necessary so that you would stay safe. And if you were to start smoking, it would be important for you to let us know because then the medication dosage would need to be changed. And some of the side effects that I mentioned before that are a little bit different besides the bleeding is that if you are having any more chest pain, dizziness, or passing out, if there's any swelling, warmth, or numbness, any change in color or pain in one side of your body, in your leg or your arm, if there's a bad headache or feeling very tired or weak, and if there's any changes in your skin color to a very dark tone like black or purple. And generally, a lot of people don't have any side effects or have very minor side effects. So if any of these do show up, it would be important to get a hold of your doctor. And just a few more things. It's important for you to take this medication at the same time every day. And if you miss a dose, take it as soon as you remember that you missed it on the same day that you missed it. If you don't remember until the next day, then just take the one for that day and don't take two at a time. And then just stay on the regular regimen after that. So just to clarify that, in case it's just recommended to not take more than one dose a day. So if you forget once, take it as soon as you remember it, or take the next one on the time that you usually take it on that day. I think that really wraps it up. And if just a reminder that if you have any questions, feel free to let us know, and we will see you in a few days for your blood test. Thanks, Carlos.